Hello and welcome to another episode of Ask a Nacogdoches. I'm Jeff Patterson, Chief Executive Officer for Nacogdoches Medical Center and the NMC Health Network. And today we have with us Dr. Lloyd Whitley at Pulmonology and Critical Care. Welcome, Dr. Whitley.
Welcome, Jeff. Thank you.
A lot of folks are wanting to know what pulmonologists and critical care physicians do in their community and in their office.
It kind of depends where you end up seeing me. In the hospital, in the ICU, generally you're, as intensive care, you're very sick and you may not remember seeing me. Take care of people that are on ventilators, take care of people that have serious infections. And in the office, it's just the opposite. It's generally health checks, people who have asthma, people who have emphysema, chronic coughing, and can also sometimes see people that have lung masses, more diagnostic stuff.
Well, we obviously are in an era where upper respiratory illnesses are all around us. I mean, obviously COVID, people are very familiar with the flu. We've got folks with pneumonia and other upper respiratory. What advice would you give for folks in the community as far as how they can best protect their lung health?
Obviously, don't smoke. That's the first. Second, get the available vaccines if you so choose to, which would be the flu vaccine. Stay up to date with your COVID vaccine. They have recently been released a RSV vaccine for a predominantly was a childhood illness, but it does affect adults. And that's something if you choose to take that. But the main thing is don't smoke and update your vaccines and be sure you have the pneumonia vaccine.
With respect to lung cancer, with folks who have risk factors, what are some things they should be doing to evaluate their health?
If they have more than 20 or 25 pack-year smoking history, Medicare and other private insurances now will cover yearly low radiation CT scanning of the chest, looking for pulmonary nodules, which is how lung cancers appear within the lungs. And that's, besides not smoking, that's the most important thing that you can do.
Thank you. Dr. Whitley, when you're not at work, what are you doing for fun?
Spend time with my wife, try to travel some. I like to read, I run. That pretty much takes care of my free time.
Well, I know you're quite busy here, so that makes a lot of sense. And I'd like to thank all of y'all for joining us again for another episode of Ask a Nacogdoches. See you next time.